Heart attacks. A heart attack, or MI, which stands for myocardial infarction, is a serious medical emergency in which the supply of blood to the heart has suddenly stopped. And it's normally caused by a blood clot. Now, people think a heart attack and a cardiac arrest are the same thing, but they're not. A heart attack and a cardiac arrest are both medical emergencies, but when someone suffers from a heart attack, they are conscious, whereas if someone's in cardiac arrest, they're unconscious and need CPR performed to them. Now, as soon as you suspect someone is having a heart attack, the first thing we must do is call the emergency medical services, and then we're going to sit the casualty on the floor in what we call the W position, and we'll stay with them, reassuring them until medical help arrives. Now, symptoms of a heart attack can vary from person to person, but they normally include pain. And the pain is in the centre of the chest, and they describe it as a dull pain or like a crushing pain, like there's a heavy object pushing on them. Now, the pain can radiate from the chest up to the jaw, through the neck, also down the arm and into their back. They may also explain shortness of breath, and they may feel weakness on one or both sides of the body. They might also feel a great sense of overwhelmment or anxiety or feeling of impending doom. They might feel sick or actually be sick. They also go very pale in colour, and they just generally look unwell. Now, it is important to know that not everyone experiences a severe chest pain when they're having a heart attack. And this is particularly the case with many females, although I don't like to be gender specific. And sometimes the chest pain can also get confused with indigestion. But it's normally a combination of symptoms that is important in determining whether a person is having a heart attack and not actually the severity of the chest pain. And the only way you're going to know someone is having a heart attack is by doing an ECG, and the only way you're going to know you've had one is by blood tests. So if you suspect these signs and symptoms, always call the emergency medical services. It's better to be safe than sorry. Okay, so how do we treat a heart attack then? Well, as we said, we've already called the emergency medical services as soon as we suspect they're having a heart attack. We've sat the casualty down in the W position. Might also want to put some cushions under their knees to support them. And we're going to loosen any tight clothing. We're also going to ask the casualty if they've got any medication, and we're going to encourage them to take it, because sometimes they've been previously prescribed medication. Sometimes it may be a spray they will spray underneath their tongue. Encourage them to take it. Now, we must always be keeping an eye on that person, talking to them while we wait for the ambulance, reassuring them the whole time. And the reason we want them on the floor the whole time is just in case they go unconscious and stop breathing, we are ready to do CPR. If they're in a chair, it's going to be very difficult for us to get them on the floor by ourselves without help in order to be able to do CPR. So while they're conscious, let's get them on the floor. Now, when the ambulance come, what they will do, they'll do lots of tests on them, and then mainly an ECG, and then they'll probably take them to hospital for further tests and treatment. Now, there are two main types of treatment that a person can have in hospital. One treatment will be giving them medication to dissolve the blood clot, or they're going to go into surgery in order to restore the blood to the heart. Okay, so you might be thinking, why does somebody actually have a heart attack? What causes a heart attack? Well, coronary heart disease, CHD for short, is a leading cause of heart attacks. Now, CHD is a condition where the major blood vessels that supply the heart get clogged up with deposits of cholesterol, known as plaque. And one of these plaques has just burst or is ruptured and causing a clot to develop at the site of the rupture. The clot may just block the supply of blood to the heart, which will then trigger a heart attack. Thanks for listening, guys. Make sure you hit that subscribe button, and please just leave a comment below if you want any other videos to be shown to you. Thanks, guys.